number one, thanks for coming out today. What a beautiful day in Albuquerque, and what a glorious balloon fiesta we had this year. I've been here since 1982 as a young man, and I just don't remember, they're always great, but I don't remember a better year than this year. It seemed like the weather really cooperated. The folks from AIBF, the nonprofit that puts this event on, did a bang-up job. Our new Pilots Pavilion with Sid Cutter right out in front. I think it was probably the most photographed thing of the year in some ways. We saw all kinds of people in front of Sid's new statue. But today we're doing a special awards ceremony, and all the media knows, and most of the community knows, that on Fridays we have Friday's Heroes, where we celebrate our first responders and great work that they do to save lives. But today we're having a special edition of Friday's Heroes on Tuesday. And the reason we're doing that is because we have a gentleman with us, Antonio Marquez, who's this gentleman right here, who is going to get on an airplane tomorrow, and he's going to fly home. And it's actually, the point of our press conference today is the fact that he has the ability to get on an airplane and fly home. And there's an interesting story to tell. When you have an event like the Albuquerque International Balloon Fiesta, we have people come from all over the world. Mr. Marquez is from Brazil. This is his balloon behind us. Which balloon is it? Which is your balloon? The one on the left.
Yes.
The balloon is, and he's got. There's several balloons behind us today, but the fluorescent colored on the far left, it belongs to Mr. Marquez. And of course, anytime you have 100,000 or more people get together to celebrate, like we do at the Albuquerque International Balloon Fiesta, you do lots and lots and lots of planning for public safety. And this is a story of that, but this is also a story about great partnerships that we have in the community. So this is what happened. On Sunday, October 4th, while at the Albuquerque International Balloon Fiesta, Mr. Marquez, who is a balloon designer and a pilot from Brazil, started to experience chest pains and dizziness. His friends recognized the signs of a heart attack, which we all should know, and they asked for help from some of the zebras. We've all seen the zebras. They're the folks that come out here referee the balloon event, who immediately called the Albuquerque Fire Department. Chief Downey and his folks are here today. AFD Paramedics and EMTs rushed to the scene, and they evaluated Mr. Marquez. After checking his vital signs, paramedics knew immediately that the patient was suffering from a cardiac event. AFD escorted him to Lovelace Health System first aid station, and he was stabilized by doctors and nurses there. Mr. Marquez was then transported by Albuquerque Ambulance, who's joining us today, to the Heart Hospital of New Mexico at Lovelace Medical Center. At the hospital, Mr. Marquez went into surgery for a 100% blockage. There's a lot of medical details here. I'll skip on those, but let's just say he had 100% blockage and was having a heart attack. Doctors worked quickly to place a stent, which opened up the blocked artery, allowing blood to flow again. And while he remained at the hospital for several days to recover, he has since been released, and we're glad that he's with us today. And I got a chance to say hello to him a little bit earlier. One of the things, and I think maybe he'll comment on this, is he was amazed at the speed and the care that was given to him, which I think is something unique to Albuquerque in many, many ways. And because of that fast response, because we have great private sector medical providers in our community, things worked out. And Al Tetroff is here. Al Tetroff is here today. He is from AIBF. Al is right here. He is on the AIBF board, and he is the gentleman that's in charge of the planning and public safety from the AIBF standpoint when it comes to here. So they meet on a regular basis. They have morning briefings. We have the Albuquerque Fire Department, Albuquerque Ambulance. We have partners from the state, partners from the federal agencies, just lots and lots of people that are here to make sure that folks can have a great time and be healthy and well. And when an incident like this does happen, we're on the spot ready to help. So I'm going to have a couple people come up and speak today, and then what we're going to do is we're going to give out our Friday's Heroes coins to almost 20 people that were involved in making sure that Mr. Marquez is here with us today. But first I'm going to bring up Troy Greer. Troy is the CEO of Lovelace Medical Center, and he's going to talk a little bit about what they do at the Heart Hospital, and maybe you can explain some of the medical terminology that I would have flunked if I had to say all of that today. So Troy, thank you so much.
Thank you. Glad to do that. And on behalf of the employees of Lovelace Health System and the Heart Hospital in New Mexico, as well as Lovelace Medical Center, thank you guys for being here. Thank the AFD representatives and Albuquerque Ambulance representatives that are here, and thank you the mayor and most importantly, we're thankful for Mr. Marquez. It's great to see him doing well. Lovelace Health System has been a very proud supporter of the Balloon Fiesta for more than 2 decades. As part of that, we're responsible for ensuring that we have the appropriate supplies, the appropriate personnel, and the appropriate ability to care for patients who suffer any kind of ailment or health problem while they're here at Balloon Fiesta, which is a wonderful community event for us. And this past year, we actually treated 177 patients that were seen by 24 providers, by 53 RNs, and 29 other volunteers. Mr. Marquez in particular had a particular kind of heart condition that's very important from a time perspective. When your left descending aorta is actually occluded, the heart begins to die very quickly, and so time is of the essence. It's very important for us to ensure that we integrate very well with our EMS providers, with our transport, and with the caregivers on site. Fortunately, we were able to take care of him, and he's doing very well. It's good to see him here today with us, walking around and talking about his balloons and giving advice on how to raise them. We're also very proud of our heart hospital. It is the state's only dedicated facility for cardiac care. And because of that and our relationship with our outside providers, including Albuquerque Fire Department, we actually received accreditation in a couple of key areas. We are the facility that's received chest pain accreditation in Albuquerque. We also have received a Mission Lifeline Gold recognition for the level of cardiac care that we receive or deliver, and also the American College of Cardiology's registry for platinum performance as it relates to cardiac care. All those things are done so that we can provide exceptional care when somebody suffers here in our community from any kind of a cardiac ailment. Many of these awards are dedicated to our integration with our fire department, as well as our transport involved with Albuquerque Ambulance. So thank them very much for participating with us, especially around our initiatives with STEMI and other types of heart attack care. Speed is very, very important. And the speed is going to be important. It needs to be collaborated well. You need to have good coordination. So today, a lot of those people that are involved in that coordination are here to be recognized, unfortunately, because they're currently providing care. Many of those guests aren't able to be with us today. Many of the people that volunteered are not able to be here. And so there are many names that we're not going to mention today that were there, but we have some that are able to join us. A couple of the people that were staffing the center that day are David Demon, who is with us today. We also have to recognize those that were involved in the ED and receiving them in the cath lab. Those people that are going to be recognized are Denise Jones, Jessica Manus, Johnny Crane, and Krista Padilla. In addition to that, we have 2 of our physicians today. I believe Dr. Michael Garrett is here, who actually was the receiving physician in our tent. So Dr. Garrett is right here. And so he was the receiving physician. So special thank you to all those who attended. And thank you, Mayor, for recognizing those that work every day to ensure that Albuquerque is a safer community. Thank you.
Thank you, Troy. We appreciate it very much.
Thank you.
Thank you. Thank you. I'm going to have Chief Downey come up and say a few words, and then we're going to hear from Mr. Marquez actually through a translator. So Chief Downey's going to give you a few words and talk about some of the signs of a heart attack maybe, and just try to educate our community on what to look for in these kinds of instances. Chief?
Thank you. Thank you everybody for being here today. This is the kind of outcome that we spend months preparing for with Mr. Tetralt's leadership, with the public safety team, and Chief Padilla and Captain Whites from AFD. This is exactly what the system should look like and how it should work. Immediate recognition by Mr. Marquez. Once you've had a heart attack, you know what your next one feels like. Nauseousness, dizziness, shortness of breath, chest pain. The signs and symptoms of a heart attack are very easy for people to recognize. And this was quickly recognized. The public safety team on the field immediately got to the Albuquerque Fire Department, who was immediately able to initiate care. You can't overstate the importance of time in the type of cardiac arrest he was having. The outcomes are usually not that good, given that we now have an advanced life support capability on every EMS piece of equipment at the Balloon Fiesta. Isn't something we had 3 years ago. Having an Albuquerque ambulance unit staged at the Balloon Fiesta for rapid transport isn't something that we had 3 years ago. We continue to evolve the care that exists at the Balloon Fiesta. And it's a very rare opportunity that those of us that respond on our 911 call get to see the outcome. And to have Mr. Marquez standing with us here today as a patient that we get to see survive the incident he had just speaks to the system of care that exists in Albuquerque, from 911 to police, fire, EMS, and the hospital system. This is a big, big system, and it's nice to have a symbol of success here with us today.
Thank you, Chief. Thank you. Chief, thank you so much. We appreciate it. And I think one of the things that strikes me is imagine 100,000 people out here. One individual's in crisis. They can get that individual. They can get that individual taken care of. Get that individual to the hospital, and make things happen very quickly. Even when Mr. Marquez is just one person in a sea of individuals that are out here. With that, we're going to bring up the man of the hour, Mr. Marquez, and he's going to talk to us through a translator. And sir, the microphone is yours.
Okay.
See you.
Thank you.
You want to come up here? So would you stand here so they can? There you go.
Em primeiro lugar, eu queria agradecer o time dos bombeiros,
In the first place, he would like to thank the firefighters
porque como eu já tive outro ataque cardíaco,
because since he's already had a previous heart attack,
o mais importante é o rápido atendimento.
the most important part is how quickly you are treated.
E isso é que eu mesmo tonteado do jeito que eu estava com a doença, na hora, eu reconheci, eu via a rapidez da equipe que me atendeu.
And because he has already had previous heart attacks, he recognizes that the treatment that he received was very quick.
Aqui no campo, principalmente,
Specifically here on the field,
em seguida com os paramédicos na ambulância,
then later on in the ambulance with the paramedics,
e chegando no hospital, o atendimento de todos os exames muito rápido,
and then later on at the hospital, the way all of the exams were conducted very quickly.
e eu nunca teve nenhum momento que não tinha pelo menos 2 ou 3 pessoas, assistente ou médico cardiologista do meu lado.
And during that whole time at the hospital, there wasn't a time where there wasn't at least 2 or 3 people attending him, either a nurse or a doctor.
Então, por isso eu queria agradecer a todo o time de paramédicos, médicos, hospital,
So he would like to thank all of the team, from the firefighters to the ambulance to everybody on the field to the hospital staff
que estão ligados ao Balloon Fiesta,
that are all connected to the Balloon Fiesta.
que se não fossem eles, eu não estaria aqui hoje.
He believes that if they weren't here and they hadn't taken care of him so quickly, he wouldn't be here today.
Em poucas palavras, obrigado de coração.
In a few words, thank you from the bottom of my heart.
Okay. That's great. And we thank you, Mr. Marquez, for sharing with us. So it's special to us that you would take the time to come and say thank you to all these folks that helped you.
Ele está agradecendo que você veio para reconhecer e agradecer todo mundo que
Igualmente.
Thank you very
Thank you.
And if you will now help me, we're going to list the names and we're going to give some coins. We call these Friday's Heroes coins.
Ele quer que você ajude ele a dar as moedas.
Ok.
É para os heróis de
Okay.
sexta-feira.
And I'll read the names. If I've got staff, where are the?
Será prazer.
Where do we have the coins? Do we
It
have
will
them
be
here?
his pleasure.
They are right in here? Yes. Okay. So we've got some for our firefighters, and we have some for the ambulance drivers and the hospital professionals. And if you would join me, we'll hand these out, if that's okay.
Então você, por favor, ajuda ele.
Ok.
Okay?
Prazer.
So let's start with AFD, Captain Pat Mendoza. Paramedic Lieutenant Dan David is not here with us today, but thank you. Paramedic driver Matt Chinchilla.
Ok.
And firefighter Joe Miller isn't with us today either, but Chief, thank you so much. And we'll make sure that they get their Friday's Heroes coins. So now let's go on. This is a different, here, let me take this one. And these are different. I'll get them here. Here, I'll hand them. I'll give you some here. Well, we've got quite a stack to go through here. So from Albuquerque Ambulance Service, paramedic Jeremy Peacock. Sir, thank you.
Oh, thank you. Yes, sir. I'm glad it worked out. Thank you. Appreciate it.
EMT Jeffrey Harris.
Oh, nice to meet you.
And EMT James Lozano.
Thank you very much.
All right, let's. There's quite a few folks. So now from Lovelace Health System First Aid Station, we have several that aren't here. David Demon is not here. Oh, David's here? I had not here. David's here. He's an RN who's the first aid coordinator provider. How do I say that?
First aid coordinator.
First aid coordinator. David Demon is here. So David, come on up. Thank you, sir. Thank you. And of course, Dr. Garrett, Michael Garrett. Here's here. Doctor, thank you. Thank you, sir. And Roderick McVitie is an MD as well. Is Roderick with us today? All right. And then Kathy Pape is an NP nurse practitioner who's also not able to come. So we'll get you their coins. Make sure that you take one for them. From a nurse's standpoint, my mom's a nurse, so I got a soft spot for RNs that save lives as well. So Valerie Francis is an RN. Valerie, are you here? Is Valerie not here today? Okay. I've got Sheriff Baker, RN. Sheriff? Working. Okay, so all these X's are not here. Okay, so these folks, so these folks aren't here, but Meisha Hunt is an RN, and Narissa Gross is also an RN at Lovelace Health System. So thank you so much. And then drivers and technicians, Felisa Benavides could not join us today. Of course, these folks are working. And I'm going to try to get this right. Is it Oksana Vivchar? Yes. Who knows how to say that right? Is that correct? Thank you so much for doing that. Now from the Heart Hospital of New Mexico at Lovelace Medical Center, New Mexico Heart Institute, from the emergency room team, there was Robert McDevitt, MD, who was not able to be here, and Gerard Brennan, who also is an RN that was not able to be here. From the catheter lab team that actually did the procedure, help me with this, Mark Benares? Benyars. Mark Benyars is not here with us today, but Denise Jones is here, right? Dennis? Is it Denise? Congratulations, thank you.
Good to see you. Thank you.
Jessica, is it Manus or Manus? Manus, thank you so much. Johnny Crane. Is Johnny here? Johnny, thank you, sir. And last but not least for today, Krista Padilla. Krista, thank you so much. And just to let you know, Al has already talked to me about the next steps that he thinks are important for public safety. So we'll be working with our legislators to try to even improve our first aid facilities out of this facility even more. We'll be doing some capital outlay requests to try to improve the facilities out here at the Albuquerque International Balloon Fiesta Park. So Al Tetral, thank you so much again. All the firefighters, ambulance folks, everybody at Lovelace, everybody at the Heart Institute, thank you so much. Most of all, Mr. Marquez, come back and see us next year, my friend.
Oh,
all right.
Thank you.
Thank you so much.
Thank you so much.